In this episode, we will talk about how to get rid of depression. What is depression? Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activities. In 2019, 2.8% of adults experienced severe symptoms of depression, 4.2% experienced moderate symptoms, and 11.5% experienced mild symptoms in the past 2 weeks. The percentage of adults who experienced any symptoms of depression was highest among those aged 18 to 29, 21.0%, followed by those aged 45 to 60 for 18.4% and 65 and over 18.4%, and lastly, by those aged 30 to 40 for 16.8%. Women were more likely than men to experience mild, moderate, or severe symptoms of depression. Non-Hispanic Asian adults were least likely to experience mild, moderate, or severe symptoms of depression compared with Hispanic, non-Hispanic white, and non-Hispanic black adults. Though depression and grief share some features, depression is different from grief felt after losing a loved one, or sadness felt after a traumatic life event. Depression usually involves self-loathing or a loss of self-esteem, while grief typically does not. In grief, positive emotions and happy memories of the deceased typically accompany feelings of emotional pain. In major depressive disorder, the feelings of sadness are constant. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It can also influence relationships and some chronic health conditions. Conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone. But if you're feeling down or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition that can get worse without proper treatment. Depression symptoms. Depression can be more than a constant state of sadness or feeling blue. Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms may also be ongoing or come and go. General signs and symptoms. Not everyone with depression will experience the same symptoms. Symptoms can vary in severity, how often they happen, and how long they last. If you experience some of the following signs and symptoms, trusted source of depression nearly every day for at least 2 weeks, you may be living with depression. Feeling sad, anxious, or empty. Feeling hopeless, worthless, and pessimistic. Crying a lot. Feeling bothered, annoyed, or angry. Loss of interest in hobbies and interests you once enjoyed. Decreased energy or fatigue. Difficulty concentrating, remembering, or making decisions. Moving or talking more slowly. Difficulty sleeping, early morning awakening, or oversleeping. Appetite or weight changes. Chronic physical pain with no clear cause that does not get better with treatment. Headaches, aches or pains, digestive problems, cramps, thoughts of death, suicide, self-harm, or suicide attempts. The symptoms of depression can be experienced differently among males, females, teens, and children. Males may experience symptoms related to their mood, such as anger, aggressiveness, irritability, anxiousness, or restlessness. Emotional well-being, such as feeling empty, sad, or hopeless. Behavior, such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, or engaging in high-risk activities. Sexual interest, such as reduced sexual desire or lack of sexual performance. Cognitive abilities, such as inability to concentrate, difficulty completing tasks, or delayed responses during conversations. Sleep patterns, such as insomnia, restless sleep, excessive sleepiness, or not sleeping through the night. Physical well-being, such as fatigue, pains, headache, or digestive problems. Females may experience symptoms related to their mood, such as irritability, Emotional well-being, such as feeling sad or empty, anxious, or hopeless. Behavior, such as loss of interest in activities, withdrawing from social engagements, or thoughts of suicide. Cognitive abilities, such as thinking or talking more slowly. Sleep patterns, such as difficulty sleeping through the night, waking early, or sleeping too much. Physical well-being, such as decreased energy, greater fatigue, changes in appetite, weight changes, aches, pain, headaches, or increased cramps. Children may experience symptoms trusted source related to their mood, such as irritability, anger, rapid shifts in mood, or crying. Emotional well-being, such as feelings of incompetence, I can't do anything right, or despair, crying, or intense sadness. Behavior, such as getting into trouble at school or refusing to go to school, avoiding friends or siblings. Thoughts of death or suicide, or self-harm. Cognitive abilities, such as difficulty concentrating, decline in school performance, or changes in grades. Sleep patterns, such as difficulty sleeping or sleeping too much. Physical well-being, such as loss of energy, digestive problems, changes in appetite, or weight loss or gain. Depression causes. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include brain chemistry. There may be a chemical imbalance in parts of the brain that manage mood, thoughts, sleep, appetite, and behavior in people who have depression. Hormone levels. Changes in female hormones estrogen and progesterone during different periods of time, like during the menstrual cycle, postpartum period, perimenopause, or menopause may all raise a person's risk for depression. Family history. You're at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions may trusted source put you at higher risk, such as chronic illness, insomnia, chronic pain, Parkinson's disease, stroke, heart attack, and cancer. Substance use. A history of substance or alcohol misuse can affect your risk. Pain. People who feel emotional or chronic physical pain for long periods of time are significantly more likely trusted source to develop depression. Risk factors. Risk factors for depression can be biochemical, medical, social, genetic, or circumstantial. Common risk factors include sex. The prevalence of major depression is twice as high in females trusted source as in males. Genetics. You have an increased risk trusted source of depression if you have a family history of it. Socioeconomic status. Socioeconomic status, including financial problems and perceived low social status, can increase a trusted source your risk of depression. Certain medications. Certain drugs, including some types of hormonal birth control, corticosteroids, and beta blockers, may be associated trusted source with an increased risk of depression. Vitamin D deficiency. Studies trusted source have linked depressive symptoms to low levels of vitamin D. Gender identity. The risk of depression for transgender people is nearly fourfold that of cisgender people, according to a 2018 study. Substance misuse. About 21% of people who have a substance use disorder also experience depression. Medical illnesses. Depression is associated with other chronic medical illnesses. People with heart disease are about twice as likely trusted source to have depression as people who don't, while up to 1 in 4 people trusted source with cancer may also experience depression. Treatment for depression. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatments works best. It's common to combine medical treatments and lifestyle therapies, including the following. Medications. Your healthcare professional may prescribe selective serotonin reuptake inhibitors SSRIs. SSRIs are the most commonly prescribed antidepressant medications and tend to have few side effects. They treat depression by increasing the availability of the neurotransmitter serotonin in your brain. SSRIs should not be taken trusted source with certain drugs, including monoamine oxidase inhibitors MAOs and in some cases thioridazine or orapimazide. People who are pregnant should talk to their healthcare professionals about the risks of taking SSRIs during pregnancy. You should also use caution trusted source if you have narrow-angle glaucoma. Examples of SSRIs include citalopram Celexa, escitalopram Lexapro, fluvoxamine Luvox, paroxetine Paxil, Paxil XR, Pexiva, and sertraline Zoloft. Alternative therapies. Ask your doctor about alternative therapies for depression. Many people choose to use alternative therapies alongside traditional psychotherapy and medication. Some examples include meditation, stress, anxiety, and anger are triggers of depression, but meditation can help change the way your brain responds to these emotions. Studies trusted source show that meditation practices can help improve symptoms of depression and lower your chances of a depression relapse. Acupuncture. Acupuncture is a form of traditional Chinese medicine that may help ease some symptoms of depression. During acupuncture, a practitioner uses needles to stimulate certain areas in the body in order to treat a range of conditions. Research trusted source suggests that acupuncture may help clinical treatments work better and may be as effective as counseling. Natural remedies and lifestyle tips. Exercise. Aim for 30 minutes of physical activity 3 to 5 days a week. Exercise can increase your body's production of endorphins, which are hormones that improve your mood. Avoid alcohol and substance use. Drinking alcohol or misusing substances may make you feel better for a little bit, but in the long run, these substances can make depression and anxiety symptoms worse. Learn how to set limits. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you feel better. Take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoiding negative people, and participating in enjoyable activities. Take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening. I hope I helped you in any way possible and have some things to do in your day. This will cure depression. Thanks for watching.